Hey everybody, Dr. Amanda Nanasy, Sports Vision Pros, and March is Concussion Awareness Month. So I'm here at Holy Cross Sports Medicine at iSport with Dr. Logan Kaleta to ask him a couple of questions. So thanks for your time.
Thanks for having me.
So we refer patients to each other quite frequently, and a question that a lot of people ask is when would a concussion patient be referred for a vision consultation? So when do you send patients over to me?
Yeah, great question. So with our clinic, we run a pretty comprehensive evaluation, and part of that evaluation includes ocular and motor screening, vestibular screening, and so whenever we're seeing issues with pursuits, whether there be saccadic issues, convergence insufficiency, or accommodative issues, or even differentiating between some vestibular dysfunction, we'll typically send to Dr. Nancy and her team to look at. And even if there's not a lot of dysfunction, sometimes if there's significant symptom provocation, or if a patient's just complaining of subjective symptoms, we use your services to really help us out and help the patient recover after that injury.
Another question that I get from people is that if they don't have a really great support network for concussions in their area, how do I know if my kid had a concussion, if I need to seek any medical advice from a doctor?
Yeah, great question. I mean, anytime you see or you hear about someone complaining of a change after they had some sort of traumatic event, whether it be in sport, whether it be fall, whether it be at work, whenever you can isolate it to that kind of incident, then it would kind of point you into something's not right, and it would require further attention to see if there is, a concussive injury, or if there's something else going on, like a neck injury, or, it could be a stress event and things like that going on medically.
What kind of baseline information might you have from student athletes that you could compare before and after to see if there have been any changes?
Great question. One of the things that we're looking at from a baseline standpoint is getting you obviously more involved. I think, from my standpoint, I think that eyes are probably the most overlooked area in the entire body and in our system. And so hopefully having you more involved with baselining athletes, we can get a good idea of who might need ocular services just from a general health standpoint, as well as if an injury occurs, we can compare that data. Certainly with our area, thankfully, we have some good support financially to have our high school athletes being baseline from a neurocognitive standpoint. There's also some outreach being provided financially to use sway baseline testing, so they can look at their balance testing or reaction time or other ocular screening as well.
Fantastic. And we'll include some information about what is sway if you want to learn more as far as some of the other tests that he's referring to. So thanks so much, Dr. Kaleta, for your time.
Thanks a lot for being here.